My name is Candace Williams, and I'm a 25-year licensed esthetician specializing in melanated skin. I have a studio in the Charlotte, North Carolina, in the Ballantyne area. I see 95% of my clients are skin of color. I see a lot of different issues that they have, and we're going to talk about some of those today. Dull skin, dehydrated skin, and also post-inflammatory hyperpigmentation. Dull skin, dryness, and stubborn dark spots. Let's talk about why and how to glow up safely. Lack of exfoliation is a lot of times dead skin collects on the skin. And in skin of color, you'll see you'll have different areas where you might have a darker forehead. Your skin doesn't necessarily match. A lot of times you'll see breakouts with this. Skin needs to be turned over to be brighter, to look more even, to give you better skin tone, better texture. It's essential for ethnic skin because a lot of times you may find that you have acne. You need to turn it over so it looks its best, so it's working properly. You want to make sure your moisture barrier is taken care of. You get the best looking skin from when skin is exfoliated and healthy. People will confuse dehydrated skin with dry skin, and they're two different things. Dry skin is lack of moisture, where dehydrated skin is lack of water. A lot of times when people feel skin sensitivity or a product burns, it's because their skin is dehydrated. If you wash your face and you feel that tightness, that's dehydrated skin. Using products that are going to repair that moisture barrier, hyaluronic acid, just using things that are going to replenish that skin and give it back some water the way that it needs to be. Making sure that not using things like harsh cleansers to break that skin down. You make sure you're drinking water. Water is your friend. As you start to build that barrier up and get a lot of moisture back into that barrier, you'll find that your skin is less sensitive. I find that a lot of skin of color can be very sensitive. So it's just making sure that you're not dehydrated, and that's not causing your sensitivity. So a lot of solutions for dehydrated skin. I love a good hydrating toner. That toner with hyaluronic acid, those are wonderful. You can use those throughout the day. And also there's a product from Face Reality that I like now. It's called Barrier Repair Moisture. That's a great product with a lot of hyaluronic acid. It really helps to build that moisture barrier up. Skin Script has a hydrating toner. That's one of my favorite. Feels really good going on. And it's also, just really cooling and feels nice on top of the skin and underneath your moisturizer. Because I do a lot of chemical peels, one of the things that you can do best to make sure before you're coming in for a chemical peel is to make sure your skin is hydrated. Dehydrated skin is going to make you more sensitive to a chemical peel. I tell people making sure that moisture barrier is good before you're doing any type of professional treatments, because you'll be a lot less sensitive. If your skin feels tight after washing, even if it's shiny, you're probably dehydrated. So hyperpigmentation is overproduction of melanin in certain areas. A lot of times it can come from damage to the skin and, the body producing melanin in that area. Inflammation from breakout, from acne, from the sun, you can get hyperpigmentation. It does not fade fast. A lot of people have this myth that you can get rid of hyperpigmentation fast. It didn't get there overnight. It doesn't take care of itself overnight, but using the proper products will really help with hyperpigmentation and making sure that you're using the proper SPF. Although we know black doesn't crack, we still need SPF to protect us. We get skin cancer, we can get age spots, hyperpigmentation, all of these different things that happen to our skin just like anybody else. Not wearing sunscreen is a non-negotiable. For black skin, it is absolutely a myth that we are not supposed to wear sunscreen. For safe brightening ingredients, I like from my clients, I like to talk about tyrosinase inhibitors. A lot of people, tyrosinase inhibitor is what keeps melanin. It regulates the melanin in your skin using products like that you probably heard of, like niacinamide, kojic acid, arbutin, hydroquinone. Hydroquinone is my favorite. A lot of people are anti-hydroquinone, but I love hydroquinone as far as fading dark spots when used properly. That's probably the top tyrosinase inhibitor, because it's gonna, especially if you're having breakout, you want to protect yourself from getting new acne scars. If you're already trying to fade things, you don't need new things. So it's going to kind of block these new dark spots from coming. So making sure you're using that. Also, one that I failed to mention was vitamin C. Vitamin C is also great for that. When it's properly stabilized. Using good vitamin C product is great for protecting that skin and making sure that it's bright and fading dark spots. A lot of my clients, I do a lot of chemical peels on skin of color, and just most of my people, if you're coming in to get a chemical peel, your issue is hyperpigmentation. So I'm telling people a lot of things that you can do to kind of prep for that. You can use a hydroquinone product before you come in to get a chemical peel, making sure that your skin is not dehydrated. So when you're doing chemical peels, making sure that you're taking care of your skin the way that you're prepping it properly to do the peel. There is a product from Dermadality called HQ Lightening Gel, and when used in combination with a retinol and vitamin C, the three of those together pack a lot of punch. And you can treat a lot of this at home. And then if you do chemical peels in between, the results are really good, really phenomenal results. So when talking about using products like hydroquinone, you need to make sure you are absolutely using a sunscreen. I tell people, if you are using a hydroquinone product and you are not going to wear sunscreen, don't bother. You need to protect that skin, keep your skin out of the sun. I recommend, if you're going to be somewhere where there's a lot of sun, reapplying the sunscreen, and also a lot of times wear a hat just to kind of protect that skin from the sun. If you're fading and you're going to be in the sun, it's going to defeat the purpose of what you're trying to do. So making sure that you're taking the proper steps, doing it the right time of year. Maybe if you're in the sun for summer, it's not the proper time for you to start a product like hydroquinone. So we want to correct, protect, prevent, and that's how we basically tackle hyperpigmentation and take care of it for good. So just to recap, exfoliation is your foundation, hydration is your fuel, and hyperpigmentation is the long game. I just want to emphasize safe practices. For a lot of these products, you will need professional help. I do online consultations. You're able to reach out to me. I can go over products with you, what's going to be the best for your skin. We can talk about what you have at home. One of the things that I do is I'll go through your products that you have at home and see if there are anything that we can add to it to make what you have better, or things that you're missing. We can go over all of those things to make sure that you get the best results for your skin. If you have any questions, be sure to drop it in the comments. I'll be happy to answer those, or maybe we'll talk about it in the next segment. If you're interested in any of the products that we talked about today, you can purchase them on our website at www.skinbycandace.com. And remember, glow smart, glow safe, and glow proud in the skin you're in.